Hey there, and welcome to our channel. Herbs, the time-tested healers. So today we are going to discuss about an interesting natural healer, Astragalus. It is also known as Huang Qi, milk vetch. It is derived from a bean or a legume. Although there are several species of anthracites, the majority of anthracitic astragals in astragal supplements include anthracites astragalum, Astragalus membranaceus. Xerophytic perennial is native to northern China and Mongolia. It has been used in Chinese traditional medicine for centuries in conjunction with other herbs. The flavonoids, cyclolanostane-type saponins and polysaccharides are the main bioactive compounds. Astragalus contains the plant pigments, 4-mononetin, astrae of lavan, astraterocarpin, 2,3 dihydroxy-7, 4,dimethooxy is of lavone and isolecaridiogenin. It affects both spleens and meridian in the lungs. Used to treat symptoms of spleen deficiency like diarrhea, tiredness, spontaneous sweating and lack of appetite. Natural dietary supplement used for certain health conditions. Strengthens superficial resistance and to promote the discharge of pus and the growth of new tissue. Crude extract has shown antiviral and immunostimulant activities, and inhibits the activities of murine retroviral reverse transcriptase and human DNA polymerases. Stimulates the immune system. It has antioxidant effects that inhibit free radical production. Used to help improve overall weakness. Lowers blood glucose level and blood pressure. Very high dose may suppress the immune system. The root of the plant is used for medical purposes. There are no well-controlled trials in individuals with astragallosis for any disease. About safety for this herb. Astragalus is safe to take by mouth and with proper dosage. Up to 60 grams daily for 4 months has been used without adverse reactions. Some species, which are not typically found in supplements, may be harmful to cattle. Astragalus strains grown in the US have swainsonin, a neurotoxin, which has caused animal locoweed poisoning. Others contain selenium, which may be toxic to cattle. Astragalus is not safe to use during pregnancy or breastfeeding. However, some animal studies suggest that it may be harmful to both the mother and the fetus. Recent studies. Nephrotic syndrome patients are prone to infections. In a 2013 review, it was found that taking astragalus might be less likely to cause an upper respiratory tract infection in children with this condition than taking prednisone on its own. The review concluded that the quality of the studies was poor. In a small 2009 study, a herbal formula based on astragalus was not effective in prolonging the life expectancy of people suffering from advanced lung cancer. The study, which involved 24 patients, was partly supported by the NCCIH. Astragalus injection had more therapeutic effect in diabetic nephropathy patients, including renal protective effect. While there was some promising evidence to suggest that when used in conjunction with conventional therapy, astragalus therapy may reduce serum creatine phosphokinase protein loss in urine and reduce the impact of certain complications, including anemia and malnourishment, the quality of evidence was low. In vitro and in vivo tumorigenesis studies were conducted to evaluate the anti-tumor activity of A. membranaceus. The 5 bioactive fractions were extracted from the root of the microorganism. AI was identified as the most potent of the 5 fractions in terms of mitogenicity in murine splenocytes. In vitro and in vivo, murine macrophages pretreated with AI demonstrated increased cytostatic activity toward MBL2 tumor. AI also induced priming of tumor necrosis factor (TNF) in tumor-bearing murine mice. Taken together, the results suggest that A. murinaceus may exert anti-tumor effects both in vitro and vivo, which may be induced by activating the host anti-tumoral immune response. Conclusion. Safety is also an important consideration, particularly when extracts made from the raw plant are used in the form of an injectable. Although it is widely used in the People's Republic of China, astragalus injections are not usually approved for use in other countries. According to a previous review, the side effects of astragalus and its preparations were relatively minor compared to other herbal products. Astragalus has a wide range of therapeutic applications, making it a popular choice among traditional Chinese medicine physicians for the treatment of a variety of medical conditions, including cardiovascular, cerebral, renal and gastrointestinal disorders. Thanks for watching our video. For more, please do like, share and subscribe and hit the notification bell for latest updates.